red wine and the French paradox and the alcohol U-shaped curve. All right, so
Yeah.
it's holiday time. You're going to hear those things. People will use those as excuses to indulge, right?
Yep.
Lightly as excuses. I don't mean it in a serious way, but people say, oh, red wine's good for you. Let's take another glass. So define the U-shaped curve and the paradox and what happened there.
So a U-shaped curve, as I will trace out with my finger now, looks like a U. So basically what happens is you have a certain risk of cardiovascular disease. The risk starts to go down as you drink more, and then it starts to go up as you drink a lot more. So the highest risk is the people who drink a lot and the people who drink zero, with the lowest cardiovascular risk being for the people who drink a little bit. And that is something that people repeat many times, saying that a little bit of alcohol is good for you, that it's protective for your heart. And so it's sometimes called a J-shaped curve or a U-shaped curve. And it's the idea that it's not linear, it's not straight. Because if alcohol was purely bad for you, you would expect that the more you drank, the worse it became. But when you analyze data and you see a U-shaped curve, that suggests that a little bit of alcohol is actually protective. And this is the data that has fueled the myth that alcohol is good for your heart, a myth that was made a lot, that was popularized at least in North America after Morley Safer did a story on 60 Minutes about the French paradox, which was purported to explain why heart disease rates were lower in France than they were in America, even though the French ate more fatty food and smoked more and had a number of other potentially negative cardiac risk factors in their population. So that's the myth. That's what the data shows. Understanding why the U-shaped association exists is mathematically very fascinating. There's a few factors that play into it, but the biggest and probably the simplest one is the idea of reverse causation. And reverse causation goes something like this. The people who drink zero alcohol and who are at higher cardiovascular risk probably drink zero alcohol for a reason. They probably used to drink and then quit, or were told by their doctor, don't drink alcohol because it increases your blood pressure, it has a lot of sugar in it, it's not that good for you. They may have developed cancer, they may have developed, liver disease. So there's probably a reason why these people are not drinking alcohol, because most people drink some alcohol. Some people drink zero for cultural, religious reasons, what have you. But most people drink some alcohol some of the time. So if you have somebody who reports zero alcohol intake, there's probably a reason for that. So it's not that the zero alcohol intake is causing disease. It's that the people who are sick drink zero alcohol. So you've reversed the causation. You've gone from A causing B to B causing A. And there's a few different terms for that in the statistical literature. It's also referred to as the protopathic bias. There's a few sort of variants of it. But it basically happens when you take a cross-section of a population and don't account for the fact that things change over time. And yes, maybe somebody's not drinking alcohol now, but they used to drink alcohol in the past. And so not having that time varying exposure is the reason why these studies show this U-shaped association, when if you account for that, you can eliminate a lot of that statistical artifact and realize that, no, it is pretty linear, all things considered, in terms of the risk of drinking alcohol.
You can find data to suggest it, but once you delve into the data, you see that, oh, people aren't actually, they don't have a they don't have a shorter survival rate due to the fact that they're not drinking. It's because they were sick with something else. And
Exactly.
that
They
seems
were
like
sick.
something they could account for in the study, though.
Well, it's actually not that easy, to be honest with you, because it would be very easy for us to sit back here and be like, oh, these studies are terrible.
That's my job.
Yeah.
Sorry.
Analyzing data is actually a lot more complicated than people realize it is. And it's when I supervise students, which I do occasionally, when they're analyzing data, I always like to have them analyze the data themselves rather than just like farm it out to a biostatistician. Because I think there's a value in you working with the data yourself, and for you to realize that a lot of the decisions that you have to make are really just arbitrary. You just have to make an arbitrary decision. Do you want to take this data and lump it into category A or category B? If you have people who are ex-smokers, do you want to treat them as active smokers or former smokers, or are they their own category? There is no inherently right or wrong answer, but the choices you make can influence what the outcome of the data is. So you have to be smart. You have to think about it. Sometimes you have to look at things from different perspectives and see if the results change based on the decisions you make. And that is a significant finding. So, there is no right or wrong way to analyze data. There's just a more careful and less careful way to analyze data. And I think that's the problem that we get into. People will just analyze something, get the answer they want, and be satisfied with that and not entertain the possibilities like, oh, if I analyze the data this way, I show that red wine is protective. I analyze the data this way, I show it's harmful. Maybe that means that there's no real major effect here at all if the outcomes can be so arbitrary. And that's, I think, a nuance that a lot of times is lost because a lot of people will, my clinical colleagues who want to do research will, often gather a data set. They'll ask for my help and analyze the data, and I'm happy to do it when they're friends of mine. And they say, look, well, just tell me what the answer is. I'm like, well, that's not the right way to approach it because the answer can almost be anything you want it to be. It's the process that matters. And that's the point I try to instill in the students, that it's the process that's almost more important than the final result, because the decisions you make when you're framing the data are going to determine what the outcome is going to be.